Measles. Understanding, prevention, and treatment. Introduction to measles. What is measles? Perception of measles. Often seen as a minor rash and fever. Resolves within a few days. Severe health complications. Particularly affects children under 5. High contagion rate. 90% of unprotected individuals in close proximity get infected. Effective protection. MMR vaccine offers long-lasting immunity. Protects against all strains of measles. Measles is often seen as a minor rash and fever, but it can lead to severe complications, especially in young children. It is highly contagious, with a 90% infection rate among unprotected individuals. The MMR vaccine provides effective, long-lasting immunity. Some individuals may perceive measles as merely a minor rash and fever that resolve within a few days. However, measles can lead to severe health complications, particularly in children under the age of 5. Measles is highly contagious. If one person contracts the virus, up to 90% of unprotected individuals in close proximity will also become infected. The most effective protection against measles is the measles, mumps, and rubella, MMR, vaccine, which offers long-lasting immunity against all strains of measles. Risk factors. Risk of measles. Anyone not protected against measles is at risk. Measles in the United States. Declared eliminated in 2000. Still common in many parts of the world. Travelers and measles. Brought into the U.S. by unvaccinated travelers. Travelers are mostly Americans and sometimes international visitors. Higher risk groups. Some people are at higher risk of severe complications. Anyone not protected against measles is at risk. Although measles was declared eliminated in the U.S. in 2000, it is still common globally. Unvaccinated travelers often bring measles into the U.S. Some groups are at higher risk of severe complications. Who is at risk? Anyone who is not protected against measles is at risk. Measles was declared eliminated from the United States in 2000. However, measles is still common in many parts of the world. Every year, measles is brought into the United States by unvaccinated travelers who get measles while they are in other countries. These travelers are mostly Americans and sometimes international visitors. Some people are at higher risk of experiencing severe complications from measles. Before vaccines. Early documentation of measles. 9th century, Persian doctor writes about measles. 1757, Francis Home discovers measles is infectious. Measles in the United States. 1912, measles becomes a serious concern. Healthcare providers required to report cases. 6,000 annual deaths in the first decade of tracking. Before vaccines. Pre-vaccine era. 1963, measles vaccine introduced. Almost every child caught measles by age 15. 3 to 4 million infections annually in the U.S. 400 to 500 deaths, 48,000 hospitalizations, and 4,000 encephalitis cases each year. In the 9th century, a Persian doctor wrote about measles. By 1757, Francis Home discovered it was infectious. In 1912, measles became a serious concern in the U.S. Before the 1963 vaccine, nearly every child caught measles, leading to millions of infections and thousands of deaths annually. Before vaccines. Back in the 9th century, a Persian doctor was among the first to write about measles. Fast forward to 1757, and a Scottish physician named Francis Home discovered that measles was caused by something infectious in the blood. By 1912, measles had become a serious concern in the United States, with healthcare providers required to report every case. During the first decade of tracking, around 6,000 people died from measles each year. Before the measles vaccine was introduced in 1963, almost every child caught measles by the time they were 15. Each year, about 3 to 4 million people in the U.S. got infected. Sadly, this led to 400 to 500 deaths, 48,000 hospitalizations, and 4,000 cases of encephalitis, a dangerous swelling of the brain, annually. Creating the vaccine. Initial efforts in vaccine creation. 1954, John F. Enders and Dr. Thomas C. Peebles collected blood samples during a measles outbreak in Boston. Aimed to isolate the measles virus and create a vaccine. Successful isolation from a 13-year-old named David Edmonston. Development and licensing. 1963, Enders and team developed a vaccine from the Edmonston B strain. Vaccine licensed in the U.S. Creating the vaccine. Improvements and standardization. 1968, Maurice Hillman and colleagues improved the vaccine. Created the Edmonston-Enders strain, weaker and safer. Standard measles vaccine in the U.S. since then. Often combined with vaccines for mumps and rubella, MMR, or with mumps, rubella, and varicella, MRV. In 1954, Enders and Peebles collected blood samples to isolate the measles virus. By 1963, they developed a vaccine, later improved by Hillman in 1968. This Edmonston-Enders strain is the standard measles vaccine in the U.S., often combined with other vaccines. Creating the vaccine overview. In 1954, during a measles outbreak in Boston, John F. Enders and Dr. Thomas C. Peebles collected blood samples from 6 students. They aimed to isolate the measles virus and create a vaccine. They succeeded with a sample from a 13-year-old named David Edmonston. By 1963, Enders and his team had developed a vaccine from the Edmonston B strain of the virus, which was licensed in the U.S. In 1968, Maurice Hillman and his colleagues improved the vaccine, making it even weaker and safer. This version, known as the Edmonston-Enders strain, has been the standard measles vaccine in the U.S. since then. It's often combined with vaccines for mumps and rubella, MMR, or with mumps, rubella, and varicella, MRV. Eliminating measles. Initial goal and early success. 1978, CDC aimed to eliminate measles by 1982. Widespread vaccine use reduced cases significantly. 1981, reported cases dropped by 80% compared to the previous year. Outbreak and response. 1989, measles outbreak among vaccinated school-age children. Health authorities recommended a second dose of MMR vaccine. Improved first dose coverage further reduced cases. Measles elimination. 2000, measles declared eliminated in the U.S. No continuous transmission for over a year. Success due to effective vaccination program and improved control. In 1978, the CDC aimed to eliminate measles by 1982. Despite not meeting the target, vaccine use reduced cases by 80% by 1981. A 1989 outbreak led to a second MMR dose recommendation. By 2000, measles was declared eliminated in the U.S. due to effective vaccination and control. In 1978, the CDC set an ambitious goal to eliminate measles in the U.S. by 1982. Although they didn't quite hit the target, the widespread use of the vaccine drastically reduced measles cases. By 1981, reported cases had dropped by 80% compared to the previous year. However, a measles outbreak in 1989 among vaccinated school-age children led health authorities to recommend a second dose of the MMR vaccine for all kids. This change, along with better first dose coverage, further reduced measles cases. In 2000, measles was declared eliminated in the United States, meaning there was no continuous transmission of the disease for over a year. This success was due to an effective vaccination program and improved measles control across the Americas. Measles symptoms. Common complications. Ear infections. Diarrhea. Severe complications, pneumonia and encephalitis. Signs and symptoms. Immediate medical attention required for suspected measles exposure. Dangerous for infants and young children. Initial symptoms, 7 to 14 days post-infection. High fever, potentially exceeding 104 degrees Fahrenheit. Cough. Koplik spots, 2 to 3 days after initial symptoms. Measles rash, 3 to 5 days after initial symptoms. Measles can cause serious health issues, especially in young children. Symptoms appear 7 to 14 days post-infection, including high fever, cough, and runny nose. Koplik spots and a rash follow. Seek immediate medical attention if exposed. Measles symptoms and complications. Measles can lead to significant health complications, particularly in children under 5 years of age. Common complications include ear infections and diarrhea, while more severe complications encompass pneumonia and encephalitis. Signs and symptoms. Immediate medical attention required. If you suspect that you or your child has been exposed to measles, contact your healthcare provider immediately. Measles is not merely a minor rash, it can be dangerous, especially for infants and young children. Initial symptoms, 7 to 14 days post-infection. Symptoms of measles typically manifest 7 to 14 days after exposure to the virus and include high fever, potentially exceeding 104 degrees Fahrenheit. Cough. Runny nose, coryza. Red, watery eyes, conjunctivitis. Koplik spots, 2 to 3 days after initial symptoms. Tiny white spots, known as Koplik spots, may appear inside the mouth 2 to 3 days after the onset of initial symptoms. Measles rash, 3 to 5 days after initial symptoms. The measles rash emerges 3 to 5 days after the first symptoms. It usually starts as flat red spots on the face at the hairline and then spreads downward to the neck, trunk, arms, legs, and feet. Small raised bumps may also appear on top of the flat red spots, and the spots may merge as they spread. When the rash appears, the fever may spike to over 104 degrees Fahrenheit. High-risk groups. Children under 5 years of age. More susceptible to severe complications. Adults over 20 years of age. Higher risk of severe outcomes. Pregnant women. Increased risk of complications. Individuals with weakened immune systems. Includes those with leukemia or HIV infection. Measles can be severe for everyone, but certain groups are at higher risk. These include children under 5, adults over 20, pregnant women, and individuals with weakened immune systems like those with leukemia or HIV. High-risk groups. Measles can be severe in all age groups, but certain populations are more susceptible to complications. Children under 5 years of age. Adults over 20 years of age. Pregnant women. Individuals with weakened immune systems, such as those with leukemia or HIV infection. Severe complications. Hospitalization. 1 in 5 unvaccinated individuals in the U.S. require hospitalization. Pneumonia. 1 in 20 children with measles develop pneumonia. Leading cause of death from measles in young children. Encephalitis. 1 in 1,000 children with measles develop encephalitis. Can cause convulsions, deafness, or intellectual disability. Death. 1 to 3 out of every 1,000 children infected with measles will die due to respiratory and neurological complications. Pregnancy complications. Measles can lead to severe complications. Hospitalization is required for 1 in 5 unvaccinated individuals. Pneumonia affects 1 in 20 children, and encephalitis affects 1 in 1,000 children. Death occurs in 1 to 3 out of every 1,000 infected children. Pregnant women with measles may face premature birth or low birth weight. Severe complications. Hospitalization. About 1 in 5 unvaccinated individuals in the U.S. who contract measles require hospitalization. Pneumonia. As many as 1 in 20 children with measles develop pneumonia, the leading cause of death from measles in young children. Encephalitis. approximately 1 in 1,000 children with measles will develop encephalitis, which can cause convulsions and result in deafness or intellectual disability. Death: nearly 1 to 3 out of every 1,000 children infected with measles will die from respiratory and neurological complications. Pregnancy complications: measles in pregnant women can lead to premature birth or low birth weight. Long-term complications: subacute sclerosing panencephalitis, SSPE. Rare but fatal disease of the central nervous system. Arises from a measles infection acquired earlier in life. Typically develops 7 to 10 years after initial measles infection, even if the person appeared to have fully recovered. Incidence and risk factors. Rarely reported in the United States since measles elimination in 2000. 7 to 11 out of every 100,000 at risk among those who contracted measles during 1989 to 1991 resurgence. Higher risk for individuals who contract measles before age 2. SSPE is a rare but fatal disease caused by measles, developing 7 to 10 years after infection. It's rarely seen in the U.S. since 2000, but was a risk for those infected during the 1989 to 1991 resurgence, especially before age 2. Long-term complications. Subacute sclerosing panencephalitis, SSPE. SSPE is a rare but fatal disease of the central nervous system that arises from a measles infection acquired earlier in life. SSPE typically develops 7 to 10 years after the initial measles infection, even if the person appeared to have fully recovered. Since the elimination of measles in 2000, SSPE is rarely reported in the United States. However, among those who contracted measles during the 1989 to 1991 resurgence in the U.S., 7 to 11 out of every 100,000 were estimated to be at risk for developing SSPE. The risk is higher for individuals who contract measles before the age of 2. Common complications. Ear infections. Occur in approximately 1 out of every 10 children with measles. Diarrhea. Reported in less than 1 out of 10 people with measles. Importance of vaccination. Vaccination as the key prevention method. Consult healthcare provider for MMR vaccine. Ensures protection against measles and complications. Measles can lead to complications such as ear infections and diarrhea. Ear infections occur in about 1 in 10 children with measles, while diarrhea is reported in less than 1 in 10 people with measles. Importance of vaccination. Vaccination as the key prevention method. Consult healthcare provider for MMR vaccine. Ensures protection against measles and complications. The best way to prevent measles is through vaccination. Talk to your healthcare provider about the MMR vaccine to stay protected against measles and its complications. Measles vaccination. MMR vaccine. Protects against measles, mumps, and rubella. Provides lifelong immunity for most individuals. MMRV vaccine. Protects against measles, mumps, rubella, and varicella, chickenpox. Offers comprehensive protection. Impact. Significantly reduces prevalence of these diseases in the United States. The MMR and MMRV vaccines are highly effective in protecting against measles and other diseases. They provide lifelong immunity for most people and have significantly reduced disease prevalence in the U.S. The most effective way to protect against measles is through vaccination with the measles, mumps, and rubella, MMR, vaccine. Alternatively, children may receive the measles, mumps, rubella, and varicella, MMRV, vaccine, which also provides protection against chickenpox. Vaccination with MMR and MMRV offers lifelong immunity for most individuals, significantly reducing the prevalence of these diseases in the United States. Available vaccines. MMR vaccine. Combines measles, mumps, and rubella vaccines. 2 versions available in the U.S., MMR2 and Priorix. Both versions are recommended and interchangeable. MMRV vaccine. Combines measles, mumps, rubella, and varicella, chickenpox, vaccines. Licensed for use in children aged 12 months to 12 years. There are 2 vaccines available for measles, mumps, and rubella. The MMR vaccine has 2 versions, MMR2 and Priorix, both recommended. The MMRV vaccine also includes varicella and is for children aged 12 months to 12 years. Vaccination recommendations. MMR and MMRV vaccines can be administered with other vaccines. Healthcare provider can guide on appropriate vaccine. MMR vaccine schedule for children. First dose at 12 to 15 months old. Second dose at 4 to 6 years old. Older children, adolescents, and adults. 1 or 2 doses if no evidence of immunity. Doses spaced at least 28 days apart. International travelers. Ensure full vaccination before traveling. Increased risk during mumps outbreaks. Both MMR and MMRV vaccines can be given with other vaccines. Children need 2 doses, older individuals may need 1 or 2. Travelers and those at increased risk may need additional doses. Consult your healthcare provider for guidance. Post-exposure vaccination. Consultation with doctor. Discuss receiving the MMR vaccine after exposure. MMR vaccine is safe post-exposure. MMR vaccine benefits. May prevent the disease. Can result in a milder illness. Timing for measles exposure. Receiving MMR vaccine within 72 hours offers protection. Alternative protection. Immunoglobulin, IG, within 6 days of exposure. Provides protection or reduces severity. If exposed to measles, mumps, or rubella, consult your doctor about the MMR vaccine. It is safe post-exposure and may prevent or lessen the illness. Receiving it within 72 hours of measles exposure offers protection. Alternatively, immunoglobulin within 6 days can provide protection or reduce severity. Who should get vaccinated? Students at post-high school educational institutions. Higher risk due to close living quarters and social interactions. Healthcare personnel. Frequently exposed to infectious diseases. International travelers. Travelers to regions where measles is common. People of childbearing age. Women planning to become pregnant should be vaccinated. Groups at increased risk during mumps outbreaks. May need an additional dose of the MMR vaccine. MMR vaccination is essential for children and adults without immunity. Key groups include college students, healthcare workers, international travelers, women planning pregnancy, and those in mumps outbreak areas. Who should not get vaccinated? Severe allergies. Severe allergic reaction to a previous dose of MMR or MMRV vaccine. Life-threatening allergies. Pregnancy. Weakened immune system. Bleeding disorder. Recent blood transfusion. Tuberculosis. Recent vaccines. Feeling unwell. History of seizures. Taking salicylates. Certain individuals should avoid or delay MMR vaccination. Consult a healthcare provider if you have severe allergies, are pregnant, have a weakened immune system, a bleeding disorder, recently had a blood transfusion, have tuberculosis, received other vaccines recently, are feeling unwell, have a history of seizures, or are taking salicylates. Safety and efficacy. MMR vaccine safety. Highly safe and effective in preventing measles, mumps, and rubella. Side effects are typically mild and resolve on their own. No link between MMR vaccine and autism. Safe for breastfeeding women. Effectiveness of MMR vaccine. 1 dose, 93% effective against measles, 72% effective against mumps, 97% effective against rubella. 2 doses, 97% effective against measles, 86% effective against mumps. Vaccinated individuals may still contract diseases but with milder symptoms and reduced spread. The MMR vaccine is highly safe and effective, with mild side effects. One dose is 93% effective against measles, 72% against mumps, and 97% against rubella. 2 doses increase effectiveness against measles to 97% and mumps to 86%. Vaccinated individuals may still get sick but with milder symptoms. Possible side effects. Mild side effects: soreness, redness, or swelling at the injection site. Fever. Mild rash. Temporary joint pain and stiffness. Rare serious side effects. High fever leading to seizures. Most people have no side effects from the MMR vaccine. Mild side effects include soreness, fever, rash, and joint pain. Rarely, high fever leading to seizures may occur. Finding and paying for the vaccine. Vaccine availability. Doctor's office. Pharmacies. Workplaces. Community health clinics. Health departments. Schools. Religious centers. Vaccine costs. Health insurance. Most plans cover vaccines. Vaccines for Children, VFC, program. Vaccines can be found at various locations including doctors' offices and pharmacies. Most health insurance plans cover vaccines, but verify with your provider. The VFC program offers free vaccines to eligible children. Measles transmission. Highly contagious virus. Resides in mucus of nose and throat. Spreads through respiratory droplets. Transmission methods. Coughing and sneezing. Viable on surfaces and in air for up to 2 hours. Contact with contaminated surfaces. High contagion rate. 90% infection rate for non-immune individuals in close proximity. Infectious period, 4 days before to 4 days after rash appearance. Measles is a highly contagious virus that spreads through respiratory droplets. It can remain viable on surfaces and in the air for up to 2 hours. If one person contracts measles, 90% of nearby non-immune individuals will also become infected. The virus is transmissible from 4 days before to 4 days after the rash appears. Modes of transmission. Airborne transmission. Measles spreads through the air when an infected person coughs or sneezes. The virus can linger in the air and on surfaces for up to 2 hours. Possible to contract measles by being in a room where an infected person has been. Direct contact. Spread through direct contact with respiratory droplets from an infected person. Infected by touching contaminated surfaces and then touching the face. Measles can spread through airborne transmission when an infected person coughs or sneezes, and the virus can linger for up to 2 hours. It can also spread through direct contact with respiratory droplets or contaminated surfaces. Contagious period. Contagious duration. Individuals are contagious from 4 days before the rash appears. They remain contagious until 4 days after the rash appears. Unawareness of disease. Individuals can spread the virus before knowing they have measles. Importance of vaccination. Vaccination is crucial due to the highly contagious nature of measles. Prompt medical attention. Seek medical attention if exposure to measles is suspected. Individuals with measles are contagious from 4 days before to 4 days after the rash appears. They can spread the virus even before knowing they have it. This highlights the importance of vaccination and seeking prompt medical attention if exposed. Diagnosis. Characteristic symptoms. Distinctive rash. Koplik spots inside the mouth. Diagnostic tests. Blood test. Throat swab test. Urine sample test. Measles is diagnosed by its distinctive rash and Koplik spots. Diagnosis can be confirmed with blood tests, throat swabs, or urine samples. Measles is typically diagnosed based on its characteristic symptoms, such as a distinctive rash and Koplik spots, small, bluish-white spots on a red background inside the mouth. A healthcare provider may also confirm the diagnosis with a blood test or a test using a throat swab or urine sample. Treatment approaches. Symptom relief. Fever reducers like acetaminophen, ibuprofen, or naproxen sodium. Hydration to prevent dehydration. Plenty of rest for recovery. Complication management. Antibiotics for bacterial infections like pneumonia or ear infections. Vitamin A supplements to reduce severity in children. Post-exposure prophylaxis. Post-exposure vaccination within 72 hours of exposure. Immune serum globulin for pregnant women, infants, and immunocompromised individuals within 6 days of exposure. Measles treatment focuses on symptom relief, managing complications, and post-exposure prophylaxis. Fever reducers, hydration, and rest are key for symptom relief. Antibiotics and vitamin A supplements help manage complications. Post-exposure vaccination and immune serum globulin can prevent or lessen the disease's severity. Self-care measures. Humidifiers. Help ease a cough. Relieve sore throat. Isolation. Prevent spread of measles. Isolate infected individuals. Protect unvaccinated or immunocompromised people. To manage measles, use humidifiers to ease coughs and sore throats. Isolate infected individuals to prevent spreading, especially to those unvaccinated or with weakened immune systems. Thank you for taking the time to review this material. I hope I was able to increase your knowledge on the subject matter.